My name is Aaron Levo. I'm the Vice President of Communications and Public Affairs. Pleased to be with you as normal as a moderator for today's Hamilton Health Sciences Town Hall. Today on December 9th, it's our Grey Cup edition Town Hall, among other things. We've got a packed agenda and the opportunity as well for our participants to win some Grey Cup tickets today, actually. So if you haven't logged on, please make sure you log on with your name so that we will enter all of our participants at today's town hall by name into a draw to randomly select a winner to receive a pair of Grey Cup tickets for this Sunday. So if you haven't logged on using your name, just put your name in and make sure that we can get a hold of you through your Hamilton Health Sciences email account, and a lucky winner will walk away with some tickets for this weekend's game. So our president and CEO, Rob McIsaac, couldn't be with us today. Unfortunately, he was double booked. But we do have our chief, sorry, not again, Dave. We have Dave McKeag, everybody. And Dave's definitely going to take on the duties that would normally be afforded to our president and CEO to walk us through today, the opening. So Dave, over to you. And to kick things off, thanks, everyone.
Thanks, Aaron. A stellar introduction. I feel like maybe I should introduce myself, but I do actually work here. So I am the EVP Corporate Affairs and CFO, and very happy to fill in this morning and welcome everyone to this, what is actually our, as amazing it is to say, our last town hall together for 2021. But as we begin, I would first like to acknowledge that we are privileged to provide care on lands that Indigenous peoples have called home for thousands of years. Okay, so I guess I just have to start off with wow. I mean, when we first learned about the novel coronavirus 2 years ago this month, I don't think anyone really imagined or understood what we were facing, what we would be going through, and that we would still be talking about it, let alone seeing it in our hospitals or community, and maybe worried about our families at this time as we watch the new developments. So we have overcome so much as an organization and dealt with so much, and are ever thankful for the last 2 years and the work that's been done in these very trying times. You know, there's been unprecedented work and efforts, opening surge care, essentially a hospital and a hotel, a massive rollout of the COVID-19 vaccine, which many of you were very enthusiastic at the first of the line, showing the way for our community. I can recall that vaccine clinic being set up on the fly in about 48 hours, transforming office space into highly secure and excellent space for care. So, you know, I guess really a big thank you for continuing to show up for your community, for your patients, for your colleagues every single day. It's a phenomenal thing to watch HHS in action. There does continue to be uncertainty around COVID, as we all know. We'll have to navigate that together as we always do, and I would say as we've shown that we're fully capable of. This morning we'll cover a few topics: our normal operational update and our normal epidemiology update, although this will be the first time we hear from Dominic around thoughts and information around Omicron. So it's going to be an interesting update. Project Odyssey we'll hear more about, which, just like UHN, continues into its exciting next phases. We'll talk about our EDI Workforce Survey, and just as importantly, our efforts to say a heartfelt thank you through our Winter Star Week. So I'll move into the agenda, and today we're going to turn it over to Bruce Squires for an operational update on behalf of Sharon Pearson, who also couldn't be here with us this morning. So Bruce, over to you.
Thanks very much, Dave, and good morning, folks. Yeah, very pleased to be able to step in for Sharon Pearson, our EVP, just to share a little bit of that update around operations across the organization. And you know, as Dave has already noted, really we can understand that it's a time of an intersection of a number of very significant challenges that play out as consistently high occupancy across the entire organization. You know that, you're feeling that, and that occupancy is mixed with significant amounts of acuity. It's manifesting as well with high volumes of ambulance activity, and that's putting significant pressure on our ability to continue flow, particularly at the Juravinski Hospital, but again, really across the site. Some of that is related to that intersection of delayed and deferred care through the course of the pandemic, the viral activity that is circulating, non-COVID, kind of appropriate with the season, but probably earlier this year, perhaps again as a result of the time where viruses were not circulating. Challenges in certainly in the long-term care capacity and in the community, both of which, of course, affect the volume and the acuity coming into the hospital and our ability to flow patients outside. The story, though, safety continues to be the focus that I know all of us place as first and foremost, along with the care of our patients across the system, and that really is just one further manifestation of how hard you're working. So Dave's already said it. You're going to hear it, I think, from everyone today. Such a big thank you on behalf of Sharon. Let's go to the next slide, please. Specific to those comments around ambulance offloads, you'll see a little bit here of the data, and part of the story is, this location and site is the busiest in the province and experiencing the most significant pressures over, approaching now the last year. That proportion of our ED visits coming by ambulance, you can see a third of those at both at the Juravinski and at the HGH coming by ambulance at the top of the list across Ontario. And so again, what a pressure on our ability to flow. Next slide, please. Right now, the COVID activity within the hospital as it relates to hospitalizations and ICU is quite a bit lower than it was in the heart of waves. So that directly is not what's driving our occupancy challenges, but a source, of course, it does create some acuity challenges. So you can see December 8th, 9 patients, less than 5 across ICU, across wards, in terms of on ECMO and in terms of outbreaks. And so you can see when we're saying less than 5, because when it is less than 5, we're limiting those that specificity so as to account for privacy. So we'll hear from Dominic a little bit about what we might expect coming forward in the context of increased case counts in the province and the Omicron virus, but as it relates to hospital activity, we remain much lower. Let's go to the next slide. But we really do feel, again, those acuity and occupancy pressures nonetheless, and that relates to the drivers I already referenced. And so you can see a little bit here of, what does it look like? We're 80 beds that are in use that are unfunded or in place for surge across the organization. I spoke to the long-term care challenges and community challenges, and again, so we're seeing a significant ongoing increase in the number of ALC patients as there's challenges and pressures to return to the community. That funded acute adult occupancy, 106% high yesterday over the 14 days. The MUMC figure that you see there is relates to the women's health program, so that is the adult occupancy. Again, children's side is seeing occupancies unprecedented in the history of MCH, and the averaging over 105 to 110%. So really bed occupancy pressures that we're feeling across the system. That really concludes the operational update. I have to close it, I think in the way I started it, with a thank you, a recognition of all that you've done and all that that you can continue to do, and with best wishes as we go into the holidays. Back to you, Aaron.
Thanks very much, Bruce. Just a reminder to all of our participants before I introduce our next speaker that today we're very fortunate to have been provided 2 tickets to the Grey Cup that we'll be handing out to a participant in today's town hall. Just make sure you've logged on using your name or your HHS email address so that we can reach you if you are the winner for that draw. And just a reminder too, if you have questions, we're not using the live Q&A function, but we do answer all questions through the HHS News inbox, which you can find on the hub in the town hall area. And up next, we have Dr. Barry Lum with us to talk a bit about the exciting progress across the organization and Project Odyssey, our march to go live at 176 days. Barry, what do we need to know?
Thanks, Aaron. Hi, everybody. And listen, maybe I could just take 2 seconds to add my thanks. You know, Dave and Bruce talked about all the incredible work that's been done, and despite all of that, we have continued to march forward on the Odyssey project, and it's been a tremendous contribution for across the entire organization, and our team is very grateful for everybody's involvement. Next slide, please. So I'd like to spend a little bit of time with you just talking about and trying to make sure we provide some clarity around training. And there really are 2 separate tracks for the training process, which is absolutely essential to accomplish for a successful go live. On the left-hand side, you'll see providers, and this includes our physicians, nurse practitioners, physician assistants, midwives, dentists, residents, medical learners, and they follow a track that is separate from the rest of our EPIC users. And that process will be beginning literally today with a introduction for how people will become registered. And that process will proceed with the learning sequence, as I'll describe in the next slide. On the other side of the equation are all of our other EPIC users, and this is nurses, physios, OT, PT, all of those folks will go down the EPIC user track, and we'll be telling you more about that as we go forward, but there's nothing that you need to do right today on that side of the equation. Next slide, please. So the training pathway, although there are 2 separate groups, essentially follows the same process, and that is first registration, which is an extremely important step. We have to register over 12,000 people in the LMS in order to be able to plan for every individual to be in the correct pathway for their training. First, you'll do e-learning, which will be about an hour of time on the computer to introduce you to the system, followed by mandatory classroom training. After that, you'll have the opportunity to use the system and to practice, and then there will be a mandatory assessment of the success of the training. And finally, there will be an end user phase where it'll provide folks the opportunity to customize and personalize their own EPIC sign-on so that they find and can use those pathways and those processes that are most useful to them. So as I said, on the provider side, we are starting the registration on December 20th, and we're beginning the education of the registration process today. We would anticipate starting for the rest of the EPIC users, the registration process on January 10th, and we are planning an education session for how to register for next week. Next slide, please. So in terms of other things related to getting ready for go live on June the 4th, we have and we will be distributing the day in the life cards, which I'll show you in a second. And we'll have a whole other long list of opportunities for you to stay informed and involved, which includes the regular newsletters, the bi-weekly town halls, updates on the hub and the mobile app. And then as we get closer, there will be, of course, the in-class training sessions, and there will be days set aside for understanding how patient flow and other day in the life activities will happen. You'll be hearing a little bit more soon about role-based security, which is really making sure that every person is registered correctly and can sign on correctly into the system when we go live. Next slide. So you're going to start to see these very cool day in the life cards, we call them, which are a cue card, for lack of a better term, that describes a few of the common terms that you'll hear in the EPIC world, like care everywhere and CPOE. And then on one side, it'll describe how you go about your daily activities now, and then what you can expect in the EPIC world. And there are well over 50 of these. They apply to a whole long range of activities within the organization, and we'll be distributing those going forward for you also to use as an opportunity to inform yourself, but also talk amongst yourselves and start to have conversations about what it's going to be like on June the 4th. Next slide, please. So please don't be shy to reach out to us, as always, in any form you want at odyssey@hhsc.ca. Thanks all.
All right, thanks very much, Barry. I believe we have a poll, actually, and rest assured it's not asking anything about Dr. Lum's presentation other than how excited and energized are you for the change ahead in terms of thinking about Odyssey, about EPIC. We get a poll up, you can put in your answers. Curious to just gauge how people are feeling as we go through this journey. As Barry said, we have 176 days to go live, and lots of work has been done. I know this is a huge change for the organization, and really trying to judge on a scale of 1 to 10, how much excitement is there out there for this change, the possibility in terms of how we care for patients. So we'll just give it another minute. We're at about half of our participants. Don't want to take forever. We want to make sure that we get as many people responding as we can. All right, well, maybe I'll suggest to our colleagues running the poll that we hold it there and look at our results. So we do have a large percentage of people in the top end of the category feeling a great deal of excitement for the project. And certainly, as Barry pointed out, you can always continue to learn more. I believe we have another question up for our poll. Our next question with respect to the Odyssey project and the updates that we've been receiving through the town hall and other means. On a scale of 1 to 10, 10 being highest, the information shared today makes me feel more prepared for EPIC Go Live. Some time to go. I know there's always more that we could all learn. How are you feeling about it today? Did today's presentation ring true in terms of the questions you had about where we are in the process and about what's expected of you in the near term? So 10 being highest, 1 being lowest. How did you feel about the information shared today, helping you get prepared for our EPIC Go Live? We'll, of course, be using, these results are a finger in the wind, but it's always nice to ask, and our planning teams can certainly think and reflect about what more we can do to bring information to people. Okay, so I think we'll hold there. But again, we see fairly good results. A lot of people feeling prepared, good about today's information anyways, and we'll keep at it in that forum. So as Barry pointed out, you can always learn more on the hub. And as I said at the outset of his presentation, if you have questions specifically related to anything in today's presentations, you can email to the HHS News at hhsc.ca inbox. You can also go to the hub page for our town hall and pose questions there. I know several did after our last town hall, so that's great. Thanks very much, Barry, for that update. So just a brief reminder before our next presenter, I know some people have logged on since the beginning, that today is the Grey Cup edition of our town hall, and you have the chance to win 2 tickets to the Grey Cup coming up this Sunday. We'll randomly select participants from today's town hall, and in order to do that, we'd ask that you please log in using your name or your HHS email as your handle, so that we can make sure to pull a name and be able to get you those tickets. So next up on our agenda, we have Dr. Dominic Mertz, who's our Medical Director of Infection Prevention and Control. Dominic is going to give us an update on the evolving situation with the pandemic. Of course, since 2 weeks ago, Dominic, we've learned about a new variant out there. I'm sure you'll talk about that today. I'm just curious to know where things are at. So what do we need to know?
Yeah, thanks, Aaron. I carved out a little bit more time for this town hall because of the Omicron discussion. But I will start off with what we know, which is the current status, and then go into Omicron, where a lot is unknown, as you're probably aware, and there's a lot of uncertainty, and you have to take everything with a grain of salt, including what I'm going to tell you today about it. But let's start with the numbers that are actually the truth for sure. Here, starting with the national view, you see a couple of dark, large red arrows. Still some trouble in some of the territories and First Nation reserves in terms of the highest numbers per 100,000 per week, but also Quebec now crossing the 100, while the provinces that have been struggling most over the last few months are now turning back, getting to the bottom. So Saskatchewan and Alberta in particular, but also BC, that was never as high, but is now in the 40s as well. They are in the same ballpark as we are, but you can see in contrast to those provinces out west, we have a red arrow here with a RT of 1.14 or somewhere around 1.1 at this point, depending on how the RT is being calculated. So basically, certainly in a growth period still. And what's happening in Quebec and Ontario is certainly driving what you can see on the left-hand side in terms of case numbers within Canada that are climbing now. The last peak was mostly because of the provinces out west. Now the case numbers are being driven mostly by Ontario and Quebec. Next slide. This is how our epi curve looks like in Ontario, expecting to be somewhere above the 50 by the end of this week. That's comparable to where we had been last year, November 2020, and it's already higher than what we had in that latest peaklet, I would say, end of August, beginning of September. Next slide. In terms of hospital admissions, again, comparable to where the province had been sitting at in November 2020, with around 330 admitted patients with active COVID at this point, still slightly lower than what we had mid-September, but I have no doubt that we will exceed that number this or next week. Next slide. This is the Ontario science table modeling from back in mid-November, and as you can see, it's a very simplified red line here, but we pretty much followed the possible worst case scenario, and unfortunately not the more likely scenario, which would have been less growth within the province. Next slide. They just updated the modeling earlier this week, and now you see these three potential options with current behavior, how it will exceed probably 3,000 by the end of January in terms of case numbers. With current behavior and assuming 50% of the 5 to 11-year-olds vaccinated by end of December, which I think we are on a very good track to achieve, it may level off below 2,000 cases per day. If in addition to that, to the vaccinating the 5 to 11-year-olds here only 30%, keep in mind that we already are at roughly 25%, I believe, at this point, plus a 15 decrease in transmission through additional public health measures, which would be first and foremost aiming to decrease contacts, we may be plateauing much earlier. But again, a very wide range of what might be happening, and this is all without taking Omicron into account. Next slide. In terms of ICU admission, you also see a range somewhere between 250 and up to 400 ICU admissions by mid-January. So far, I think the ICU admissions have been remaining relatively stable, I would say. We were around 140, now we are around 160. So there was roughly 10% increase since we were at the lowest level after that wave 4A. Next slide. Here, that picture still shows the same. So the darker the color or the more purple the color, the higher the case numbers per 100,000 per week. And we still see the same picture, that those areas mostly hit in the second and third wave, so namely the GTA, but also including ourselves, are doing much better than some of those public health units that have done extremely well. For example, Kingston, going through the entire pandemic to date. So we see sort of the opposite of what we would have seen when we went into the winter wave last year, but certainly also Toronto, Peel to some extent as well, sees an increase in case numbers as well. But other public health units started much earlier and have much higher numbers at this point of time. Next slide. So Hamilton, somewhere in the middle at this point. We had that quite significant wave 4A, end of August, beginning of September, higher than most of the other public health units in the province. We then had a nadir a couple of weeks ago and now are climbing again, currently at roughly 40 cases per day. That's where we are sitting. That's comparable to that shoulder that we had last year, mid-October, when it first came down again, and then we had the steep increase towards the peak of the second wave. And it's comparable to where we had been mid-August this year. Next slide. This also translates, of course, into the unlinked cases per 100,000 per week, which we have historically been using for policy decisions. We are currently in that range of 10 to 15 per 100,000 per week. So still in that low epi range, but certainly moving towards that threshold of 20 per 100,000 per week. Next slide. These are the hospital admissions in Hamilton, and here you can see we have had our lowest numbers 2 weeks ago, which were as low as never seen before November last year. And we are still lower than what we had in summer 2021 here, as you can see. But again, you see a tendency for a slow increase here, but certainly still in good shape, as you've seen in the data previously shared with you. Next slide. That's the local modeling from our public health service, Wisconsin. Again, you see 3 potential models or plausible scenarios, I would say. The blue line is the most likely, which is some level of reopening or people relaxing in terms of their masking, physical distancing, capacity increasing, combined with vaccinations at the current pace, I would say. And you can see that for now, we follow that, are leaning a little bit more towards the red scenario, which is the upper sort of confidence interval for this scenario. But you can also see that we probably will continue to see an increase into the holidays, probably see a holiday peak from social gatherings around the holidays, and then probably some dip going into early January and then increasing again when the usual social interactions are restarting. Next slide. In terms of hospital admissions, the predictions are that it remains relatively stable until end of January based on these projections here. I added that red dot where we are currently sitting, which is 0.7 admissions per day for Hamiltonians, so slightly better than the roughly 1 that's been predicted. But I think from a hospital perspective, that's certainly the good news, that assuming this holds true, we shouldn't get overwhelmed by COVID patients in the weeks and months to come. Next slide. But then comes Omicron, right? And with Omicron, that's the data here from Gauteng, South Africa, where it was first identified. Mind you, we don't know whether that's where it actually evolved. Showing you both hospital admissions as well as cases per day, 7-day average, and how quickly that increased. It looks like it's plateauing now, so they may turning down maybe in the next few days or week or two. But it's been a significant rapid spread based on the data that we can see, which suggests that in combination with it outcompeting Delta at this point of time, that it's probably more easily transmittable than Delta. Next slide. Some data here from Denmark, which has a very sophisticated sequencing resources, I would say, and you can see here as well, it's been there for at least end of November, and now they start to see a significant increase. The issue with sequencing always is, unless you do everything, you may significantly over or underestimate the true proportion of a new variant, because you may either target the highest risk for the variant, then you sort of overestimate the proportion, or you don't do enough sequencing, and our sequencing may be those that actually aren't necessarily representative, or you're missing significant pockets of the new variant, and then you're underestimating it. The province is planning to go back to sequencing close or 100% of our positive COVID cases again, and this will give us very reliable data moving forward to see how or whether and how quickly Omicron may actually outcompete Delta. Next slide. Now, why is it outcompeting? And this is a quite complex figure. What you see from the lower left corner to the upper right corner is how the effective reproduction rate changes, increasing towards the right upper, the red zone. And you can see that Omicron, when you're looking at that red line, is much closer to red than Delta is, showing that I would say the success in transmitting based on the data we see right now is higher for Omicron than with Delta. And then there's two explanations for that. Either Omicron transmits more effectively just because it does, regardless of immune escape. If that was the sort of the driving benefit, then you are on the very right side here, where you may have an R0 as high as 9. So in the absence of immunity, it would be roughly 50% more transmittable than Delta, so from 6 to 9 in terms of R0, and the immune escape of 30%. Or it could be the opposite. It actually transmits in a non-immune population less than Delta would, but because of the immune escape, what we see in real world is that it transmits more easily. And where exactly that balance is, that's still a big unknown. Next slide. There's been a lot of data like this being shared, and I just picked one of the figures here, which is looking at the level of immune escape in lab-based assays, where you're looking at neutralizing antibodies and what titers are required, or whether the titers are still enough to neutralize Omicron here versus the wild type. And what they found in this study, and there's a big range in terms of what people find, but here it was suggested that the effectiveness in the lab is 40 times lower against Omicron than against the wild type. This is with the Pfizer vaccine here. What seems to be a common theme when you're looking at those, again, it's only lab-based, but that patients or people who would have had the vaccine and the infection are much better off against Omicron than those who have only been vaccinated, because immune response probably is broader if you had the infection on top of the vaccine at some point. Next slide. All of this being said, there's been some positive news as well when you think about the impact that Omicron will have on us. And this is just, Pfizer came out with that yesterday. Nobody has seen the actual data. All I'm showing you today is not peer-reviewed articles. So there's still a lot of unknowns, and just keep that in mind with whatever you read at this point. Pfizer suggested that 3 doses of the Pfizer vaccine will neutralize the Omicron variant, but that 2 doses show a significantly reduced neutralization titers. So that's the kind of data I showed you previously. The 3rd dose so a booster dose of the Pfizer vaccine will increase your neutralization antibody titers by 25-fold, and that can make up of that lower effect that it has on Omicron. The good news here, or the other good news other than that the boosters may actually help us also preventing infection, is this piece here, that most of that surface of the spike protein, even with Omicron, isn't significantly different from the wild type. As such, our T-cell response should still be holding up. And the T-cell response is probably the most important response when it comes to preventing severe disease. So it's well possible at this point that while you see a reduction in prevention of infection, the protection from severe disease and death may be holding up similarly well against Omicron as it did for Delta, as it did for the wild type or any other VOCs that we have had. But again, take it with a grain of salt. That's just some data by media release that have been shared, which may hold true or may not. Next slide. Where are we at in Ontario? That's the data from a couple of days ago. I think by yesterday we were at 31 cases. We are probably in the hundreds. There's many cases out there that screened positive for Omicron, so are likely Omicron cases, but not confirmed yet. So I wouldn't be surprised if we were at several hundred cases within a week from now. But that's also because we're only catching up with the sequencing. There's been outbreaks with Omicron, as you may have heard as well. So it looks like it may take over from Delta relatively quickly if the current trajectory continues. Next slide. That's the modeling looking at the effect that Omicron may have. And as I mentioned, there's a lot of uncertainty as to why and to what extent and how quickly Omicron will outcompete Delta. The brown line here is that most likely plausible scenario with Delta only. And then you can see 2 purple scenarios here, depending on how more effective Omicron is in terms of transmitting and how significant that hit on immunity, mostly vaccine immunity, will be. And then you see a wide range here, somewhere between 2,000 and 3,000 cases per day by mid-January. And obviously that effect would continue over the months to come. So while it doesn't look like a huge difference by mid-January, it could have much more of an effect when you think about how things will look like in February and March, depending on how Omicron will behave in our specific setting. Next slide. So I tried to summarize here the likely impact of Omicron. And as I said, everything here may be entirely wrong, but it's the best understanding that we have at this point of time. So Omicron may well be outcompeting Delta due to either immune escape plus minus higher infectivity. It may as well be both and a combination of both. Some UK models suggest that it will only take a few weeks and Omicron will have taken over Delta in the UK, and we may see something similar here. It already spread globally, and it's too late to keep without hard stop. It's been identified in around or more than 60 countries in the meantime, keeping in mind that many countries are not able to sequence to the same extent, so they may have it, they just aren't able to identify it. The hit on neutralization levels that I've shown you, that's the kind of data that we have at this point of time. And even if that's 40 times less in those studies, doesn't mean that the vaccines are in fact 40 times less effective. For that, we need the clinical data. It's probably much less of an effect on the vaccine effectiveness in real world, but it's certainly hinting towards we will lose quite significant protection from getting infected with Omicron versus Delta. 2 doses retain some level of neutralization, so it's not that we are back to square one, and I think that's important for people to hear as well. There's still some level of prevention of infection. Prevention from severe disease is likely maintained, probably at least after 3 doses, but some data suggest that 2 doses are sufficient for that. And hybrid immunity, so hybrid would be you have had your vaccines and you have had the infection at some point, provides better neutralization than just the vaccine immunity, but you can probably make up for that again with the booster by just improving your entire immune response to the virus only through vaccines. Next slide. So going back to the topic of vaccines and how they work at this point of time, and this obviously is Delta data. You can see on the left-hand side at the bottom the COVID cases that we have, and you see, yes, it does increase among the vaccinated individuals, which is the blue line at the bottom. But again, first and foremost, it's among the unvaccinated. Very similar picture that we have had in wave 4A earlier, like end of summer, beginning of fall. Even more of a difference as previously shown for hospital admissions and for ICU admissions here, where that small proportion of people who are unvaccinated are responsible for the vast majority of hospital admissions and ICU admissions at this point of time. Next slide. Where are we at with coverage? And the way it's being reported now is from 5+, because we now have everyone eligible from 5+. The province is sitting at 85% of 5 years and older being vaccinated with at least 1 dose. Locally in Hamilton, we are at 83%. Next slide. In terms of fully vaccinated, above 80% in the province, we are sitting at 78.8%. So again, roughly 2% below that average. In terms of third doses, on the next, this is for 70+, so that's another population here. Again, roughly 2% below the provincial average being at 28% of 70+ being boosted at this point of time. Next slide. We certainly see a significant increase again in number of vaccines administered, as you can see here. Black line is your total. This is mostly driven by first doses, and the first doses are mostly driven, of course, by the 5 to 11-year-olds that have become newly eligible, and by third doses, which is that other line you can see, not sure what color, I don't see it as well on my laptop here, while the second doses otherwise are pretty stagnant because there's not many people right now who have had their first dose and are getting their second dose. We will probably see that peak once the kids are eligible for their second dose. Next slide. What also changed, which is relevant for our healthcare workers, are the federal recommendation by the National Advisory Committee for Immunizations in terms of boosters or third doses. They now recommend this for everyone who's more than 6 months out from their primary vaccine series, so 6 months out from their second dose for most of us. For adults more than 50, which is in keeping with what the province is doing starting next week, then the long-term care homes, those that got a non-mRNA vaccine first, so either AstraZeneca or the JJ, adults in or from First Nation, Inuit and Métis communities, and then for the audience here, frontline healthcare workers. In the past, the recommendation was only for those with a short interval. Now they say any healthcare worker. And on the next slide, I try to clarify the rationale for that. The rationale for the first four groups here is mostly added protection from severe disease. While for healthcare workers, unless you are in one of those categories above, it's sort of re-adding that neutralizing immunity to protect others first and foremost. And again, the same seems to be applying for Omicron. So Omicron shouldn't prevent you from getting a third dose at this point. It will not be as good as against Delta, but it looks like it can prevent infections as well with the third dose added here. Next slide. This is the third dose data just published in the New England Journal of Medicine yesterday, looking at mortality and how those who have had a third dose or booster dose here, the blue line, are less likely to have a fatal infection with COVID than those that have not received the booster. This is 50+ population. This would probably not apply to the younger population, but again, for healthcare workers that are younger than 50, the reason for the recommendation is first and foremost neutralizing immunity to prevent infection of others at the workplace, first and foremost our patients. Next slide. So just a reminder, and I showed you that previously, how to book an appointment for your third dose or your booster, whatever terminology you prefer. We have the West End Clinic, which provides the vaccines from 9 a.m. to 5 p.m., except Mondays and Thursdays when it's serving as a testing center. And you can sign up through the Hamilton vaccine portal, or you can check with your local pharmacy if you prefer that. That was my last slide, and I think the other message is just a heads up. There will be some changes based on public health recommendations or expectations in terms of how to deal with Omicron. We will have to formalize that, and that will be shared with the community or the Hamilton Health Sciences community, hopefully in the next few days. We also need to circle back to public health on some of those decisions to make sure we're on the same page. But more to come. There will be some changes in terms of how you are managed as a healthcare worker if you got exposed, if you have a household exposure and so on, but more to come. It's too early for me to share that. Thank you very much. Turning over back to you, Aaron.
Thanks very much, Dr. Mertz. Always super informative. And again, if you have any questions on anything you've heard in today's sessions, please email to the hhsnews@hhsc.ca inbox. I know that's a mouthful. You can find that email address on the hub at the town hall page. Next up on our agenda, I'll welcome back Bruce Squires to give us a bit of an update on the work underway by the President's Council on Equity, Diversity, and Inclusion, and in particular the survey that's out in our midst right now. Bruce, what do we need to know?
Yeah, thanks very much, Aaron. And you know, just as I stop, I have to, in the spirit of celebration, just acknowledge what a treasure we have in Dr. Mertz. Not only for his leadership and his expertise, but for his amazing ability to take incredibly complex, dense, and difficult to interpret information and to put it clearly. So we've been so fortunate to have Dominic, and he really has had a massive impact. I'm here again on behalf of Doctors Sharma and Halder, the co-chairs of the EDI Council. They're not able to join as they're busy clinicians to give a quick update. And reminder that the council, composed of 50 of your colleagues from across all facets of the organization, are focused in coming up with a recommendation, a framework, really a path forward to keep us moving towards our goals in terms of being an environment that is equitable, diverse, and inclusive for all of our people and our patients and families. And really, it's divided into, if I could put it this way, three big components of work. One is really around listening to and learning from our people directly around what's important, what our experience is like, what do you want them to be. It's also looking specifically at what's in place right now, policies, procedures, practices, structures, and identifying gaps and opportunities. And then a third piece, of course, is looking outside of HHS at peers, at the broader environment, at national and international exemplary practices. And our partner E&Y is helping us on that piece, but also certainly helping us on the other two key components. You put all those things together to come up with the recommendations from the council. If we go to the next slide, on that first piece around listening and learning, I want to highlight again the EDI Workforce Survey. Again, you can access that survey through your HHS device, your personal device, through paper, lots of ways to get there. Only takes about 15 minutes to complete this confidential survey. And they're going to take the results. They'll be grouped, they won't be individual, they'll be anonymized, but certainly looking to identify themes, anything that can be learned. This is one piece, as I said, of how you listen and learn to our people. Lots of information has been previously collected, and of course that task force with 50 members, many of whom have great lived experience, is bringing that to the exercise. If you got more questions about the survey or about the efforts of the council, please don't hesitate to visit the hub. I'll go to the next slide to really close with my message today is please complete the survey by noon tomorrow. You'll see that QR code. I'm told, I haven't tried it, you can hold your phone up right now and take a picture of that code, and that will take you directly to the survey. So really encourage you to do that, but also highlight, as I think Aaron has already, that you'll also be entered into a draw to win 2 tickets to the Grey Cup this weekend here in Hamilton, where the Winnipeg Blue Bombers take the field against our very own Hamilton Tiger Cats. So with that, Aaron, I will turn it back to you.
Yeah, thanks very much, Bruce. So that's another opportunity for everyone to win some Grey Cup tickets. We have the benefit of having some municipal partners dedicate those to our teams, so that's great. So filling out that survey and your participation today, 2 opportunities for that to happen. That's really great. On the topic of recognition and support, next I'll welcome Michelle Roux, our Vice President of Human Resources, to give us an update on what's happening with our Winter Star Week. Michelle, what do we need to know on this?
Thanks, Aaron. Honestly, so thrilled to be here to share with all of you our Grateful for You Winter Star Week details. I'll only spend a minute or 2 on this, but please go to the hub. You're going to see something every day, literally every day, on a different giveaway or different event that we're planning. We are very thankful again to have our e-gift cards, which were such a success and such a hit. We had such great feedback that everybody appreciated that chance to select an e-gift card that meant something to them, or even donate back to the Hospital to Home program. We have our 25th anniversary buttons. We have some great vouchers from our Volunteers Association, and we're so thankful again for their support for all of our staff and physicians. If you work at one of our locations that doesn't have a gift shop or a cafeteria, there are other arrangements being made to be able to celebrate all of you and show how grateful we are. There's a draw for the Bulldogs tickets. We've got lots of different events happening, sporting events, obviously, in today's town hall. So check our hub. You can enter now. And my favorite personally are e-cards, which we put in, I would guess about a year ago, we started using these, and we've had thousands and thousands of people send e-cards. So send a card to someone just to thank them for what they've done professionally, or even just supporting you or smiling as you walk down the hall and making your day a little bit better. and prizes will be drawn for those who send a card and receive a card. And we've even included, for those of us maybe who find it challenging or to eloquently write a thank you, some suggestions of how you might thank a colleague or a peer. So go to the hub for details, and we look forward to next week. Grateful for you, Winter Star Week. Thanks, Aaron.
Thanks very much, Michelle. It's always a highlight in the year. I know we had hoped to end early today, so I'm going to suggest maybe we hold on our celebrations. We can all extend those through the Star Week that's coming next week. We had really wanted to build a purposeful opportunity for people to end a little early today. So I'll turn it back over to Dave McKeag, our EVP of Corporate Affairs and Chief Financial Officer. And Dave, I'd just like to celebrate you for your patience and me always forgetting your title. One of the, personally, my favorite member of the President's team, Dave McKeag. Over to you for final remarks. Thanks very much.
All right, that's enough. Thank you, Aaron, though. Listen, a lot of content, a lot that we've talked about today. I think most importantly, there's some other team that's going to be playing the Tie Cats, so that's very, very exciting. So I hope lots get to take in that event. We're not having the celebrations piece, so I think it's important to just one last time reinforce what a difficult, challenging, successful year HHS has had. I'm sure we all have tough days, and I do try to come to work and remember that you never know what someone else is going through. You never know what's happening in their personal life, and just sort of a shout out for the self-care, but also the care that we do for each other, that we take care of each other. So would really just encourage that, especially as we head into hopefully a time where you can get a little bit of a rest. And if you're working on behalf of our patients, again, a huge thank you. So on behalf of the entire leadership team, thank you so much for what you do for our patients, the families, our community who must be in the hospital during this time of year. I wish you a safe and healthy and happy holiday, and have a wonderful rest of the day. Thank you so much, everyone.